Well, friends, if you're ready, let's start right away with the first week video. First of all, I need to mention this. I'll narrate the video for the first week and the video for the second week too rapidly. I will take it a little slower. Because mothers require a period of time to recuperate after delivering a baby. That is the reason why I will elucidate it gradually and with thoroughness. To tighten it, there's nothing you can do. You can move forward, but if you miss something along the way, you'll be upset. Just a heads up. First, I will talk about the normal values of babies. A baby typically grows in the womb according to certain standards. Babies born at 30 weeks weigh a certain amount. Babies born at 35 weeks weigh a certain amount. Babies completing the full 40-week or normal pregnancy period in the mother's womb are born at specific weights. Factors can alter this, but it's usually not closely related to parent size. When babies are born, their body weights typically range from 2,800 grams to 4,000 grams. Their lengths range from 47 to 52 centimeters. The circumference of the head ranges from 33 to 36 centimeters. Although these values are considered average, babies who have measurements below or above this range may frequently need additional care and monitoring. But not being within these values does not mean you are ill. If you are confused, feel free to share a comment below, and I will try to explain it to you. Alternatively, you can see your family doctor or pediatrician to ask any remaining questions on your mind. You can get the desired answer. Do not seek education from people with unknown qualifications, because they can really confuse you, lead to incorrect results, and maybe even harm you. Babies are categorized into different groups named as SGA, LGA based on their birth weights. However, whether mothers are aware of these categories or not, it will not change anything related to treatment or follow-up, so I recommend not getting too confused about it. However, if you are curious, I can also prepare these for you based on the comments that are provided below. Male babies generally tend to be slightly larger at birth compared to female babies. Factors such as your baby's birth length, birth weight, or head circumference at birth typically vary by gestational week, but certain additional circumstances can lead to your baby being born larger or smaller in weight. Foremost among these are the illnesses the mother experiences during pregnancy, especially issues like diabetes, hypertension, kidney problems, as well as substance use such as alcohol, tobacco, or drugs, leading to the birth of infants with lower weight, typically resulting in what we refer to as SGA babies. Baby's birth weight differs from adult height or birth weight. Small baby doesn't always remain small throughout life, can grow significantly over time. It does not occur in this manner. During the initial 2 years, infants experience growth in proportion to their feeding, but beyond the age of 2, parents play a partial role in determining the height, shortness, or weight of these infants as they grow. They usually lose weight during the first week, then they need to regain their birth weights by the end of the first week or within 10 days. After birth, a child weighing around 3 kilograms, which is approximately 10%, can lose up to 300 grams in weight. Later, by end of first week or around 10th day, babies regain birth weight, approximately 3 kilograms. If this is not happening, there may be additional issues with your baby. You should see your doctor. This is the physiological weight loss of a newborn. After the first week, your baby will continue to gain an average of 20-30 grams of weight per day. And from the second week, there will be a remarkable growth spurt, and the child will develop an appetite. I will explain this topic in detail when the time comes. Let's proceed with the first week video for now. I'll explain after birth. Babies are born. If the baby is normal, the baby is bathed. First, nurses administer vitamin K. They administer the first dose of hepatitis B. By putting on the top diaper and bracelet, your baby is registered. If there are no issues, the baby is left with the mother for monitoring. If your baby seems worse, if their overall status is poor, consult a specialist after initial steps have been taken. If baby is fine, they're placed by mother. If not, observe or take action for their well-being. The babies can be monitored for a certain period. If your babies have returned to normal after this period, they will be handed back to you. If the condition is poor, the newborn should be admitted to the NICU for additional examinations, monitoring, and ensuring treatment success. Here, I'm summarizing everything. If you have any specific questions, remember to comment below the video. After birth, your baby should be kept with you for 24 hours if you had a vaginal delivery, or for 48 hours if you had a cesarean section. During this time, monitoring and observation should be done in the hospital. You should be discharged afterwards. The Ministry of Health does not accept any non-routine practices in this regard. So there should not be anything like normal babies being born prior to 24 hours, or babies born by a C-section prior to 48 hours after the procedure. So why have these time frames become a topic of discussion? because there are some serious signs that can emerge within the first 24 hours of a newborn's life. And if these signs are overlooked, you may face sudden infant death at home without sufficient observation. To mitigate the heightened risks in cesarean deliveries, it is advisable to extend the discharge procedures to a duration of 48 hours. If everything is fine, we recommend observing your baby for as long as 48 hours or 24 hours, and then bringing them back for a checkup by a pediatrician within 2-3 days after discharge. Now, your baby was born in the delivery room, and we took a heel blood sample. The first sample is collected there. Secondly, the baby is fed around the clock for 24 hours, ideally not exceeding the 5th day within the first week. Later, when you go to the family identity, it is taken by the family identity at a later point in time. What is the purpose of heel blood? Heel blood is a system that was established in Turkey for the purpose of screening some commonly seen metabolic disorders and detecting certain issues in children before they develop into permanent diseases. I won't go into much detail about the heel prick test, but I will soon share a video related to it. What you need to know is that it's a very important screening test for detecting certain metabolic disorders, such as thyroid disease, phenylketonuria, biotinidase deficiency, and cystic fibrosis. You need to have your baby checked regularly by a family doctor, but there should be a certain routine to family doctor checkups. I have made a comprehensive video on this topic. You can watch the video by clicking on the provided link. In April 2019, the Ministry of Health released a circular advising the commencement of vitamin D supplementation from day 1 to prevent rickets or osteoporosis caused by vitamin D deficiency, starting immediately after birth. If additional vitamin D is not available, it should be administered until the child reaches the age of 1. Here I am adding a footnote. Babies typically use vitamin D until the end of their first year. Vitamin D is administered in an unrelated manner through the fontanelle, my acquaintances. There is no correlation between vitamin D and the fontanelle. If your baby's fontanelle closes early, are we stopping the vitamin D early? No, absolutely do not do that. There is no such information. It didn't exist in the past, it doesn't exist now. Your baby's use of vitamin D is independent of swaddling. Your newborn baby needs to undergo a very serious adaptation process, especially related to 3 systems after birth. What are these systems? I will mention respiration, I will mention the heart, but not these. You won't have much intervention in these. However, nutrition is especially crucial. Your baby will undergo highly significant steps in flora formation, encompassing the flora on our skin during the first week of life. Therefore, I will give you some recommendations. I want you to follow these recommendations carefully and seriously. You know, an infant doesn't come into contact with any germs while in the mother's womb. It is in a totally sterile environment, and after being born, as you know, our surroundings are filled with germs. However, even though some of these microbes can be harmful to our bodies, there are others that create a protective layer somewhere within us, which is commonly referred to as flora. So, what is the most effective approach to differentiate between harmful and beneficial bacteria? Our mom is actually our dad. If the baby frequently has skin-to-skin contact with either the mother or the father within the first week, the baby will be covered with non-disease-causing bacteria transferred from the mother or father to the other parent. This transfer of bacteria between the parents helps establish a healthy microbiome for the baby. Therefore, your baby will be protected by those bacteria. An interesting mechanism, but that's how it happens. Skin-to-skin contact will result in certain mutual benefits. Your baby will calm down and relax. Your wounds will heal more quickly. Your milk production will be enhanced. Your hormone production will increase, balancing your hormones. And naturally, the infant will possess a protective shield against infections by augmenting beneficial flora bacteria acquired from the mother. If it is your first baby, some unfamiliar situations related to your baby's breathing patterns after birth may be frightening to you, as they are not typical in normal relationships. One of these is what we call periodic breathing. Your baby, especially in smaller babies, may appear more frequently, but at certain times their breathing will become more shallow. It will pause. Then, in the subsequent period of time, through rapid breathing, your baby will establish a rhythm of breathing slowly and quickly without turning purple or experiencing any discoloration of the skin. Thus, this does not indicate that your baby has a disease. It demonstrates that the systems are immature, implying that they are not sufficiently developed. As they grow, while it is normal for this to happen, their current state is not abnormal. It does not require immediate intervention. We stated that these symptoms occur in small infants, and they also tend to appear more often when infants fall asleep. So do not be overly scared, do not get excessively excited. Typically, you can observe smiles in infants within the initial week. However, these smiles are reflex smiles. They are not associated with any perception. These reflex smiles will persist within the first 2 months. These manifestations usually become apparent through lullabies or conversations that you actively participate in with the baby. But these are just reflex smiles, I'm sorry. One of the important things to pay attention to in the first week is the baby's preference for one side. When your baby is born, they are symmetrical. They exhibit reflexes with both hands, attempting to throw simultaneously. When a baby demonstrates a preference for one side, exhibits a startle reflex movement, and keeps one arm motionless when startled, or if you observe that your baby extends only one arm when reaching for something, it indicates that the baby is not doing well and requires attention from a healthcare professional. The infant has probably undergone trauma during the delivery process or has encountered some problem. You need to consult your doctor for detailed information on this. You should not pick up the baby without supporting their head. In the first week, your baby may lack full control over their head movements. It is not necessary. Similar to other systems, your baby's eyes and vision are not fully developed at birth. Describing the first week after your baby's birth, it's clear that they can see at a distance of around 30 to 35 centimeters. Things it observes are typically very bright or high contrast objects. Therefore, if there happen to be highly vivid, bright red, yellow, and white lights, babies have the ability to perceive those colors, or they can also perceive substances that create extremely noticeable contrasts, such as the combination of black and white. We mentioned that there are checkups at certain stages with babies. I will explain this as the time comes. However, if your baby has feeding problems, a fever, jaundice, or is excessively sleepy, you should see your doctor outside of regular appointments. You may need to have a follow-up check again. I've made a detailed video on how to measure the fever. You can also access it from here. I'll provide a detail about temperature measurement. Avoid using Tavanka devices which measure temperature from the skin too much on babies, because they don't have a specific standard. They look different from the belly, different from the forehead, different from the neck when you look at them. If a child has been exposed to wind, it is different. If a child has sweated, it is different. Therefore, there is no standard for this, and in babies, there is no specific temperature threshold below which we can say it is normal, and above which we can say the child has a fever. Take the temperature under the armpit or in the ear whenever possible. If you can, take the measurement from the ear and aim accurately at the eardrum to show it to your doctor. Your doctor will tell you how to look into your ear. In the second step, if the temperature is under the armpit, take 2 temperatures under the armpit. They are basic models, their prices are not too high. Check out both of them from under the arm from both armpits. There should not be a discrepancy of over 0.5 degrees between them. Keep in mind that the armpit should be particularly dry and should remain beneath the armpit for a minimum of 2-3 minutes. Here's the situation. I want to provide a detail regarding fever. If your baby has a fever, you should see a doctor. I'll tell you how to handle just the presence of a fever. I've prepared a detailed video on fever. Also, if you haven't watched it, watch it. If your baby has a temperature of at least 37.8 for a minimum of 40 minutes, it means your baby has a fever. Or if your temperature is over 38 degrees in a single measurement, it means you have a fever. When suspecting a fever in babies, first remove their clothing. In a safe environment, if your baby's fever has returned to normal, it has returned. If it hasn't returned, you go directly to the doctor without giving any fever reducers and get examined. Jaundice is also crucial in the first week. This is because babies mostly eliminate jaundice by passing stool. Babies who are not fed enough usually turn yellow. Therefore, jaundice can actually be a serious indication that your baby is not being adequately nourished. And if early actions are not taken, if your baby's jaundice persists, it can lead to a condition known as kernicterus, which can result in permanent disability within the initial week of their life. Babies sleep for long periods, between 16 and 18 hours during the first week. Due to the lack of a regular pattern where the hormone called melatonin is secreted more at night and less during the day, your baby cannot distinguish between night and day. A baby sleeps as much during the night as during the day or stays awake as much as they are awake. Therefore, your baby won't distinguish between night and day during the first week. In the first week, you may have entered a repetitive cycle of feeding, putting to sleep, changing diapers, feeding again, putting to sleep, changing diapers with your baby. This is normal. It occurs in all babies, but after a certain period, it will go back to normal. For now, you just need to be patient. During these times, you can utilize certain baby products that make use of technology to decrease the level of effort you need to exert. What are these? Baby monitors are able to assist you in keeping an eye on your baby while you are resting. You have the option to utilize an appropriate crib positioned at the correct angle to gently rock your baby. You can utilize a nursing pillow while breastfeeding in order to decrease strain on your arm. Our infant should not be bathed within the initial week. The umbilical cord should not become wet. As we know, there is an organ in the mother's womb that meets the baby's nutritional and waste disposal needs. Afterward, it will shed by self-protection as it is no longer needed. However, this usually happens within the first 10 days. However, it is crucial for you not to prolong this process. The umbilical cord should only remain dry and clean. You should never leave it in alcohol. In the old days, during my time as a hospital intern, it was recommended to clean the umbilical cord with alcohol care kits. But there's no such thing anymore. We just keep it dry, keep it clean. There's no other kind of care now. We said, let's not wet our baby's belly. We said, we're not washing our baby. So will the baby remain dirty? No. In the first week, we solely provide our baby with a sponge bath. We utilize a soapy sponge. We are bathing, cleaning our baby. Then we rinse him. Then we dry him. Very simple. When giving our baby a sponge bath, you will peel off a bit of the top layer of your baby and you will see your baby shedding flakes, drying up. Don't worry. The layer formed while your baby is in the mother's womb, which we call the placenta, serves both to prevent excessive fluid loss on the upper side and to act as a barrier against germs. And as you wash, these will gradually peel off. There's no need to be afraid. During the first week, of course, you will start changing diapers and you will find a dark, tar-like, sticky, black, sometimes greenish substance in your baby's first diapers, which can be quite surprising. This substance is commonly known as meconium. Meconium is composed of nutrients, intestinal epithelial cells, and a viscous mucus-like substance called mucus. This continues to be expelled until certain days. Afterwards, this meconium will be replaced by what we call mother's milk poop, which can be yellow, odorless, frothy, and sometimes turn green. And it's a normal thing. I will come to the issue of nails. Your baby is in an environment inside the mother's womb with plenty of fluid. It will cause the nails to grow slightly faster than normal. They will continue to grow after birth as well. When should your baby's nails be trimmed? Some individuals associate it with religious beliefs, such as waiting for the baby's 40th day or other superstitious practices. These beliefs, which are viewed as irrational religious superstitions, are actually an attempt to adhere to superstitious beliefs, but it is important to trim your baby's nails at the earliest opportunity to prevent them from scratching or injuring themselves. One tip is that it will be much easier if you cut your baby's nails, especially while feeding or during sleep. He'll move less. You already know he won't feel pain, therefore there's no point in waiting. Just harm. Your infant will begin ingesting air while feeding. Acquire the skill of burping gradually. However, your baby's crying in the first week is not related to gas. It's very important. If your baby is crying in the first week, 99% of the time the reason is not being fed enough. Therefore, it is crucial for you to learn how to make your baby burp. However, you must burp your baby after each feeding to ensure that their crying is not a result of hunger or any other discomfort. When you don't burp enough, you're more likely to increase the possibility of discomfort first. In the second stage, you cause your baby to completely empty the food they've taken in while burping. In other words, you hinder your baby from gaining weight. In fact, it's more accurate to say that you harm their health. Since every baby is different, it's uncertain if your baby will become restless due to gas. If your baby is gassy, I'm sorry to hear that. There's no return. Unfortunately, you'll have to continue with it. God willing, for the next baby. I will say a few things about nutrition. If possible, let your baby be fed with the mother's milk from the mother's breast. If possible, the baby should be fed with breast milk either from the mother or through a bottle. If the mother's milk is not available, then feed the baby with formula milk. If you have a premature baby, you should use premature formula. If you have a normal baby, it should be the #1 formula. And stepping outside of these, normally we don't recommend giving formula milk to babies. Why? Due to the availability of breast milk, formula feeding becomes irrelevant. However, if your breast milk has not yet come in, the safest option to nourish your baby is by using formula milk. You will not provide other sugary beverages, unidentified ingredients, infant biscuits, but you will provide formula. Why? Because if you do not provide a baby with insufficient sugar reserves enough and leave them hungry, your baby may experience seizures due to low blood sugar levels. And God forbid your baby could experience lasting disabilities or even loss of life. You would not want that, would you? If needed, we'll start, oh, milk's here, stop formula, nothing beats mother's milk. It is the best. Another reason is that if your baby doesn't get enough nutrition, they won't be able to excrete jaundice pigments through their stool. Therefore, as the body will recover, there is a possibility that prolonged jaundice may occur in your baby, and certain issues related to jaundice may arise. Being admitted to the hospital could be the reason. When they are hospitalized, guess what they give him? If there is no breast milk, they still give formula. Furthermore, your baby is resting. As we know, in the first 10 days, the mother's milk will gradually increase. By the 10th day, it will have increased sufficiently to provide the baby with the quantity it requires completely. If your milk supply is not sufficient, feed your baby as much breast milk as you can provide. Offer the remaining portion by preparing a 30-point formula. When it finishes, you prepare a new one. If it doesn't finish, you leave it with that amount. And one very important thing again, when I prepared a video about gas colic for the future, I discuss it in there. But right now, I have to say it again. If it is possible, try to breastfeed your baby until they finish feeding from one breast. They may not be able to completely empty both breasts, which can result in an excess of lactose and cause discomfort for your child. This can be due to inadequate milk removal. What can cause the colic we mentioned? How can you increase your mother's milk? There are very simple methods. I will not mention things like mixing this and that and crawling somewhere. First, take a break and relax for a while. You're tired because the mother has gone through a serious process and the baby is still testing her nerves, pushing her physical limits. Secondly, you should drink plenty of fluids. If you don't drink enough fluids, you won't have water, you won't have milk. We suggested skin-to-skin contact with your baby to provide flora, promote wound healing, and establish milk production. Because the baby's scent will trigger the activation of certain hormones in you and increase your milk production. Maintain a well-balanced and nutritious diet and include the mineral-rich vitamins that your baby requires into that milk. Because milk will be sufficiently abundant in vitamins and minerals of all kinds. However, if you do not consume a balanced and nutritious enough diet, you may experience serious and unfortunate consequences in the future, such as the development of osteoporosis and the loss of teeth. You are starting to breastfeed, and sometimes the ideal breastfeeding position is not achieved. Sometimes cracked nipples occur. Sometimes infection occurs in the breast. Signs indicate presence of infection in the breast. If you observe these symptoms, attempt to seek medical treatment from your doctor, because the most beneficial action you can take for your baby is to breastfeed them once more as early as you can. If you experience redness, swelling, pain, hardness in your chest, and most importantly, if you have a fever, it indicates that you have an infection. Go visit your doctor. Attempt to nourish your baby every 2 to 3 hours. Therefore, your baby should be fed a total of 8 to 12 times in a typical day. If possible, start with one breast, finish it. If there is a great need, you can switch to the second breast. If possible, finish feeding from second breast too. As mentioned in first days, you may not have enough milk. Thoroughly empty both of your breasts. Subsequently, if necessary, you can prepare and administer formula to your baby. There is a simple formula when preparing formula for babies. The bottle has lines inside marked with numbers 1, 2, 3, 4, 5. Each of these corresponds to 30 cubic centimeters. This is the quantity of formula you will leave behind. In a scoop of formula, you add water up to a certain line, and that's how you prepare the formula. The Turkish equivalent of this is a 30 cc measurement, and it means a single serving of formula. Do not add extra water or decrease the water. If you add a smaller amount of water, your child will become dehydrated and develop a fever. If you add too much water, your child won't develop a fever, but they won't receive enough calories or energy, so they'll have a watery stomach and lose weight. Cannot gain weight, both situations are troublesome. Therefore, a snip 30 cc or a line. Another very important finding related to feeds. If you have prepared formula for your baby, let's say you have prepared it, your baby may have taken some, but there may still be enough formula below to possibly feed your baby. The milk has cooled down. You cannot reheat it and feed the baby. You will need to discard it and prepare a new formula from scratch. Try to keep your baby as awake as possible while feeding. First of all, you can do this. If you are trying to feed and your baby is not waking up, undress them until they wake up. If your baby still isn't showing signs of alertness, try engaging in small games with your baby to help maintain their alertness. Your baby should stay awake until the end of feeding. When it's time for your baby to sleep, sleep when your baby sleeps and listen. Because even though sleep is a vital stage for his growth, it will also give you a chance to gather your strength, both mentally and physically, in order to recover and gather your strength to face the challenges of the second, third, fourth, and fifth rounds with renewed energy and determination. When your baby falls asleep, you should also sleep right away, no matter how much your baby sleeps in the first week. You won't allow your baby to sleep as much as they want. Then, this will extend to 5-6 hours, but your baby will be regularly awakened and fed every 3 hours. This rule should never be violated in the initial week. The American Academy of Pediatrics has established specific criteria for safe sleep, resulting in a 40% enhancement in infant fatalities within the first 4 to 5 years of lifespan. Therefore, pay close attention to what I'm about to say and make an effort to apply it to your baby's needs. The baby and the mother sleep in the same room, but they sleep in different beds during the first 6 months. You should never put the baby to sleep in the mother's bed. Never. The surface where the baby sleeps should be firm. When you place your baby on a soft surface, they will not stay flat and may adopt a more rounded position. The swaddle blanket may hinder your baby from breathing. Therefore, a baby whose breathing becomes difficult may stop breathing. So it will be straight, it will be firm. If you need a lot, maybe by tilting your back slightly upwards, giving a certain incline, you can ensure that your child stays higher up. There won't be anything other than a baby in the cradle. I have prepared a video sharing all the recommendations that can help prevent sudden infant death syndrome related to these issues. You are able to open it from the description section below or watch it from above. I will be more than happy to share its link with you. In previous times, we were told that swaddling was prohibited, but the American Academy of Pediatrics now says that swaddling is recommended for your baby to feel secure and have a comfortable sleep. However, when you swaddle your baby, they will be positioned on their back, that is, lying on their back. Initially, it is extremely hot, so you should avoid swaddling tightly. Particularly when your baby starts moving, refrain from restricting their freedom of movement. Won't restrict too much, although we've mostly been talking about mothers with a 90 to 95% probability so far. This is no longer a task that can be done alone. Time for your mother's husband, or in other words, your father, to give you some responsibilities. Because the mother has not truly given up herself completely within the first week, her wounds have not yet fully healed. And if you don't turn this into a cycle, that is, if you don't ensure the mother's quick recovery, if you don't provide support, your baby will also be harmed. So support each other and raise your baby together. In the first week of your relationship, when it comes to your baby's health and safety, you need to buy a car seat in order to transport your baby in the car safely and securely. And the car seat should be positioned facing backwards. You have the option to buy it second-hand, but it is advisable to try and choose one that has been tested in car crash tests and child safety tests to determine its durability in collisions and its effectiveness in protecting the occupant's health in case of crashes. Additionally, make sure to check if it meets the latest standards in terms of technical adequacy before making your purchase decision. Because, of course, technology is also advancing in this regard, new discoveries are emerging, knowledge is increasing, and thanks to this information, our survival is increasing. Therefore, create a car seat related to health and safety for the first week. You need to choose the location of your baby in your room very carefully. Recall we discussed different beds in same room. Position of this bed is crucial. Nothing should fall on it. The crib for the baby must be stable. The crib for the baby must not tip over. All the water in the heaters in your home should be maintained at a temperature above 50 degrees. As you know, a boiling situation can occur above 50 degrees Celsius, which may cause harm to your baby. A moment of distraction, a moment of unawareness can harm your baby or yourself. Therefore, lower the temperature of all water in heaters below 50 degrees. Carbon monoxide and smoke detector in your home, and try not to be caught unprepared for a distressing situation. And here is an important finding regarding the safety and health of your baby. No smoking in the vicinity of your baby. Raise your baby in an environment where smokers are not allowed, because if there is exposure to cigarette smoke, your baby may develop asthma permanently. A permanent lung infection can occur and ultimately lead to the sudden and unexpected death of your baby. In this situation, imagine you're smoking, enjoying, and your infant is dying solely due to that. It is sad. And why drink? Do you have to drink? Once again, something I can say about health and safety is to establish your vaccination routine without fail. Actually, you don't need to create it. The Ministry of Health publishes a schedule regarding this at the beginning of each year. Initially, family physicians are informed about this. Therefore, As long as you keep up with your family medicine follow-ups regularly, you won't encounter any issues regarding vaccinations. If your baby weighs over 2 kilograms and there are no extra issues, the first hepatitis B vaccine dose will be given by nurses in the delivery room. The next vaccine is the second dose of hepatitis B in the first month. But when the time comes, I will explain this again. You can only be certain first hepatitis B dose given. Just follow up on this. You're not responsible for anything else during first week. Now, I'll quickly wrap up. I'll make a few statements about alarming scenarios, and then I'm finishing the topic. In the first week, we said that jaundice is very important. Why does jaundice occur? Typically, all babies have a certain level of jaundice, which we refer to as physiological jaundice. When the amount exceeds what we normally expect, it becomes pathological jaundice, which is also known as pathological jaundice. In this case, there may be a possibility of your baby suffering permanent damage. If you have jaundice, ensure you see your doctor for a thorough examination. In stage 2, we explained why jaundice occurs due to inadequate feeding and insufficient stool production. Therefore, you need to make sure that your baby is adequately nourished. There are several criteria to determine if your baby is being adequately nourished. These are very important criteria. Listen to them carefully. The daily feeding frequency for your baby. So they need to be fed 8-10 times a day. The second thing is the number of times your baby urinates. It's recommended that your baby should have an average of 5 to 6 diaper changes per day for proper hygiene and comfort. If your baby urinates less than 4 times a day, it means they have a significant fluid deficiency. Visit your doctor urgently. Once again, experiencing bowel movements. Typically, your baby has approximately 3 bowel movements during the initial week. I am concluding with this section of valuable tips at this moment. Keep in mind this. You should not strive for perfection. Becoming a perfect mom or dad, in other words, a perfect parent, is not possible. When you make mistakes, you will make errors, but you will try to do better by learning from the mistakes and errors you make. Each time, you will try to understand this job better, and after a while, you will do this job with your eyes closed because you have become accustomed to most of these frightening scenarios. In the upcoming videos I will mention, they will be blindfolded videos. Please remember this important detail. You won't like this. Remember it though. My advice to you is to deal with a problem every day and solve one every day. As a result, your problems will vanish completely in a few days. Concentrate on the most crucial thing as much as you can. Don't worry much about the details. Your rest and recovery are crucial because you are the one who will care for your baby. You will be the one taking care. Hence, if you are not well, your baby cannot be well. After giving birth, mothers usually try to lose the weight gained. But if you enter a different nonsensical eating pattern in an attempt to diet and do not eat enough, your wound healing will be compromised. Your care for your baby decreases. Due to insufficient mineral intake, you may experience various issues, including osteoporosis and pain. If you are in need of losing weight, endeavor to do so under the guidance and supervision of a professional doctor. Don't do it based on your own preferences. I'll tell you something that will change your idea about diet. Do you know that 40% of the normal diet of a healthy individual, which is 100 units of nutrition, should come from carbs, meaning sugars? Insufficient sugar intake leads to protein breakdown, causing the degradation of building block proteins in the body. And they will turn them into sugar and then spend them. So, in reality, you won't be making a profit. To summarize the initial map, this is the current situation. I am aware that the video is a bit lengthy. I ensure that I make sure to explain everything here in a clear and detailed manner, particularly for mothers to understand, grasp, and not overlook anything. That is all for now, until we have the opportunity to meet again in the future. You know in it.